before the break, we were talking about vaccinations and kind of where we're at. Google and Facebook have come out recently in the last couple of days and mentioned that they are going to begin to mandate vaccinations for their employees. This is going to be real interesting to see how all this plays out in the coming weeks to come. But we got Paul Seegert with us. He's the managing partner of PCS Advisers. He's been in the healthcare industry for a number of years. He is tracking this, and he's been helping consult with employers about healthcare benefits and what this looks like. And so, Paul, welcome to the Live from Seattle show.
Thanks for having me, Tim.
Yeah. Help us make sense of what's going on. I know you've been following this quite rapidly. So where are we at with the situation right now?
Well, we're at a point where I think there's some frustration on the part of those who believe everyone needs to get the vaccine for us to reach herd immunity, which is its own conversation because that's not necessarily what the science says, but there of course is a big push for that, and we're down to say 20 or 25% of the population that are not wanting to get vaccinated. And so I think where we're at now is that large employers and even the federal government as of today are creating an environment to try and heavily encourage that holdout group to get vaccinated by making it very inconvenient not to in their daily lives.
Okay. Yeah, that's well said. So how is this going to play out? I mean, give us put on your prognosticator hat here. Yeah. And how is this going to play out?
Well, I think we have to set the stage a little bit and say we've been unfortunate victims of how politicized this whole conversation has been. I don't think there's a portion of the population that just flat doesn't believe what they're told or isn't going to comply that easily because the messaging has changed pretty frequently. And you have right now, you have it, and really through the whole time, you have a situation where herd immunity has been hinged on everyone getting vaccinated when that's not accurate. I mean, there was an Emory University study that came out today. Every study from the beginning of this has confirmed that there's long-lasting and durable immunity that you gain from getting COVID itself, getting the disease itself, and getting those natural antibodies. In fact, it's showing itself to be stronger and more durable than what you might get from 2 doses of the most commonly used vaccines today. But we also see studies that have recently come out that show that after 6 months, that 100% or 95% protection from severe illness drops down into the mid-80s. And it's pretty crazy to see that we're not able to have a calm conversation about the fact that getting COVID does provide some immunity. And while there are mandates coming out now to get vaccinated to go back to certain workplaces, there are some loopholes in those where you see them saying, okay, you can get vaccinated or submit to testing once weekly or twice weekly. It's interesting to me to see that we're not talking about maybe letting those folks get testing for antibodies. What if they have immunity already? Is it necessary that they then get vaccinated? And I think it's a reasonable question to ask, and it's not one that's being discussed on most major media outlets.
And why do you think that's the case?
Well, when you've been in healthcare as long as I have, you can tend to become cynical. I try not to, but this is an arms race we're in the midst of, really. You look at Pfizer's quarterly revenue here most recently that would normally track around $11 billion. It's at $18 billion, including this vaccine. So there's a ton of financial pressure to get this going. And we have seen, and you have a whole fifth of our economy that's tied up in healthcare that almost is self-regulated because of the fact that they have so much lobbying power. So you have, while we continue to see study after study, even from the earliest, hardest hit places like Italy, confirming that people that get COVID have immunity, it's almost, it's kind of taboo to talk about it. And you'll see medical experts stand up on major media outlets saying the opposite, that herd immunity is at risk because of this 20%, when you actually can get to herd immunity, and you do get to herd immunity with diseases without a vaccine. It's just more people get sick. And I'm not suggesting that that's a good way to do it or the best way to do it, but you do get there. There was another interesting point to me in this whole conversation is if you go to the CDC's website yourself, we all have this powerful smartphone in our hands. You can see that the CDC believes that many of us have had COVID, many more of us than were confirmed to have had COVID, and as many as 8 times more. And we've confirmed in the mid 30 million cases. You add that to the unconfirmed, that they're kind of conservative in this projection, call that 240 million. And then you start to see, hey, the math says we might be at herd immunity. And then when you look at the reporting that we see in the media about this Delta variant and the surge in COVID cases, it's pretty conspicuous that we're not talking that much about hospitalizations. We're not talking that much about deaths, because at the peak of this whole experience in January, we were averaging in the mid 3,000s per day that were dying. Today, it's in the mid 200s. We had 130,000 people in the hospital on a given day and 30,000 in the ICU. Today, we have less in the hospital overall as a result of COVID than we at that time had in the ICU. So then I think it should also be reasonable to have a science-based conversation around, if you have the vulnerable part of your population vaccinated, is a surge as big of a concern? And I mean, the science-based answer would say no, but we really aren't dealing with science so much when we're talking about this. It's more so political science, it seems.
Paul, we're talking to Paul Seegert, managing partner of PCS Advisers, been in the healthcare industry a number of years. He's been following the movement of employers to mandate employees to get vaccinated. And Paul, I appreciate what you just said, because you basically just backed up everything I said in the first segment of the show. So I appreciate that. And Pedro, our producer, who was disagreeing with me like intently, is now, he's just smiling over there. You know, I'm like, this is just fantastic. So Paul, thanks for that. I'm kidding about Pedro and I. We like to banter back and forth. But I mentioned the same, in Washington, the state of Washington, the 7-day rolling average of deaths it's like 3, per day. We had like 0 yesterday. And it's like, and then I look at the newspaper and it's like, headlines surge and blah, 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 blah. And I'm like, something is not adding up here. Why something's not adding up?
Well, there's so many, what we've seen, what I've observed is that the messaging has been given to encourage a certain behavior or get a certain outcome. We haven't been telling people the truth. That's not how you gain trust. You can't tell people, don't wear a mask, you don't need it, when the intent is to say, or the goal of that is to say, we don't want to run on masks because we need them for our healthcare professionals. Just tell us. Just let us know.
Right.
And why can't we have I think an honest and open conversation about who is at risk? There are areas around the world, examples, where they simply went in and focused on protecting the vulnerable and minimizing the required changes to the rest of the population, and they have gotten better outcomes than we have. They didn't cause a huge uptick in mental illness, as an example, that we see. We monitor lots of health plans around the country. And that is one of the biggest things that we've seen, is a huge uptick in mental health diagnoses, mental health drugs related to that being dispensed, and so on. And that's not a positive thing. And when you look at the 600,000 people that have died from COVID, I think we should be allowed to have a conversation about what that group looks like. Let's define what is that high-risk group. They tend to be elderly. They tend to be obese. They tend to have other underlying health conditions. And if you're not in one of those groups, I'm not saying you don't have a moral obligation as an American to, or just a good human to engage in practices to protect those people. But what are those? There's options there. What could those be?
Exactly.
And there's areas around the world where they've done that. There's a city in Germany, it'll come to me, the name, where they have consistently outperformed the rest of the world in their results. And they didn't lock everybody down. They didn't shut down businesses. They set up certain times of the day for elderly people and other people that fit into those high-risk categories to do their shopping for groceries. And they provided free taxi rides to do it and different things where they would minimize exposure to the rest of the population for those folks. And if you worked in an elderly care facility, they would require certain things because you were interacting with a high-risk group. That makes good sense. And I think we can do that and get very good results and not get some of the negative outcomes that we have seen because we've been so blanketed in our approach.
Yeah. Talking to Paul Seegert, PCS Advisers, works with employers, employees in the healthcare industry. We're going to take a quick traffic break, but stay with us. We're going to continue this conversation, and you're not going to want to miss it.
Live from Seattle with Tim Gaydos continues on 820 AM. The Word.
Welcome back to the program today. Thanks for being with us. We are having a robust conversation about vaccinations, employers, employees. The last couple of days, Google, Facebook, they've announced that they're going to mandate vaccinations. And we're talking about that and what that's going to mean for others moving forward. We've got Paul Seegert of PCS Advisers. He's been monitoring this closely. It's an employee healthcare benefits consulting firm based in Northern California. Paul, I was going to ask you, you mentioned before, and it's, really, I think, important that you mentioned about there's other ways to find that we have immunity. In fact, my doctor just emailed me a couple days ago and asked if we wanted to get our T cells tested for COVID-19 resistance, and that there's a really new way to do that right now. This company, they've had their test approved by the FDA. They offer a couple ways to get it done. There's a practitioner version, and then there's also a consumer version. But it basically, determines how protected you are. And as you mentioned, successful natural immune system response is significantly more effective than vaccination, and especially as new variants evolve. Again, why is this T cell? How come more and more people aren't getting these T cells tested to see where we're at?
Well, I again admit and acknowledge my own skepticism of, and I'm a free market person. I believe in capitalism and everything else. But to add to your point, people that have a very mild case of COVID and get one dose of the 2-dose vaccines have very robust immunity, and that's not being discussed. And you look at these employers and say, why are they not acknowledging that? Why aren't they saying, hey, submit to an antibody test, submit to testing? What is interesting is there's always is a little bit of an out in the various mandates that we've seen come out in a flurry here in the last few days. With these tech companies, they're saying, if you want to come back to the campus, get vaccinated. So that kind of implies you don't have to come back. And then the federal government and in California, what they've done, you get vaccinated or you submit to testing. And I think you're asking a great question. Why wouldn't it make sense? I mean, it does make sense. Why can't we also talk about testing the immunity that you have because you may have been one of those, many millions of people that got COVID in an asymptomatic way that has some degree of immunity, and it may be fairly high. Let's find out. And we're down now. I was reading here in the last day or two about we're down to about 2% of the population. Not all the people that are unvaccinated. We're down to about 2%, though, that are unvaccinated and yet still have some other factors that make them higher risk. So and not that their lives are not important. I'm not saying that at all. Everyone's life is very important. But they also have freedom, and they've made certain decisions, and they have reasoning behind that. And it's interesting to see the mandates that are coming out and the discussion around and new masking and enclosures that are starting to come out. And it's really that at-risk group is very small at this point. It's incredible to see what we might be willing to do in order to accommodate a very small number of people, a very small percentage of the population that has, with their free choice and their own reasoning, said, I'm going to choose not to do that, not to get vaccinated. Do
you foresee that it could come a time where a T-cell test could be used to show your immunity? Or I think we should do that. Yeah, I think we should do antibody testing. I think we should do. It went through my entire office. Every employee that works with us, my whole family, I have 5 children, 12, 10, 7, 5, and 3. We all got COVID. And none of us, fortunately, are in the high-risk category. It was interesting to watch it go through my home. All 5 of my kids got it in about 2.5 days. They had about an 8-hour experience. One of them vomited. The rest of them just kind of got tired, took a little nap, and bounced back, and we're outside playing again. And that's fortunate, thank goodness. But they had it, and we had antibody tests, and we had immunity. So people say, hey, are you going to get vaccinated? No, I don't need to. I need to do my family and the folks in our office. We all had it. We got tested, and we're okay. And not only are we okay, we have immunity. And, another interesting thing that's should be part of this conversation, the head of the CDC said this much in the last couple of days. We're not seeing asymptomatic spread amongst people who are vaccinated or who have had COVID of this Delta variant. Is it more transmissible? Yes. But we're not seeing asymptomatic spread. So could it potentially make sense to say, if you have symptoms, wear a mask? I think that would be that's something we should be able to talk about too. But we're not having that conversation either. Yeah. There's a lot of conversations that we're not having right now. Do you think healthcare workers or other workers should be required to be vaccinated?
Well, I don't think so. I think that the very fact that you get immunity from having a disease, it says, kind of makes that a no. And in addition to that, there are studies that have shown that if you have had the disease and then you get vaccinated, your likelihood of having an adverse reaction is a bit higher. And I'm not an anti-vaxxer. My children are vaccinated to go to school, and I believe in vaccines in general. But I also believe in natural immunity that you get from having a disease. And so if there's no added protection from it, why should we recommend it or require it?
Yeah, fair. That's a good point. It's a great point. Do you think there's going to be or could be legal issues that could come down? Well, Google and Facebook, they've come out recently and have talked about mandating vaccination. What kind of legal issues could they face? If someone gets some significant side effects or what have you? I mean, what are they facing legally?
Yeah, our firm does advise employers on this kind of thing, and which is why I believe even at the federal level, you see the big headline is that they're mandating. And then when you read down into the articles, what you'll see is that there are other options. Get vaccinated or submit to testing. They're going to make it a pain, to not get vaccinated, but they're not actually mandating it that we've seen anywhere yet. Because while there is a pretty broad consensus that an employer can require it, there is fear. There's a couple of other factors involved. One is, what if I require it and then I can't staff my company? We see that in the healthcare industry, where you only have maybe, depending on the area of the country, 50%, 60% of healthcare workers in certain environments have chosen to get vaccinated. What are they going to do if they can't operate their facility without the remainder? So they need to give them an option. And the other issue is that if you have employees that have a religious reason to say they're not going to do it, that puts up a pretty quick wall as an employer that you don't want to, you can't really push beyond that very much without opening up pretty significant liability. So I think what we'll continue to see is not mandates, but coercive practices that make it inconvenient not to vaccinate, more so than mandates.
Yeah. Have you been following here in Washington State University, the football coach who, Washington State University mandated that everyone get vaccinated, and he cited personal reasons, and of course it made quite news here. Any thoughts on that?
Yeah, I think we'll continue to see that kind of thing, and I think at the brink, employers will tend to back off a bit, and I think that's appropriate. Let's allow people to make this decision for themselves. Let's acknowledge the whole scientific situation that we have. It's not the only way. The only path to immunity is not through getting vaccinated. The only path to herd immunity for us as a population isn't simply to get vaccinated. We're going to get there. I believe the math shows that we already are there. I mean, if you look at hospitalizations and deaths as a real indicator, then the Delta variant isn't cause for major alarm.
What do you make of, actually, you know what? Let's hold that question because we got to go to a quick break here. Talking to Paul Seegert from PCS Advisers in the healthcare industry. Stay with us. This is live from Seattle. We'll be right back.
Live from Seattle with Tim Gaydos continues on 820 AM. The Word.
Welcome back to the program. Glad you're with us. We got Paul Seegert of PCS Advisers. Been in the healthcare industry many years, working with employers and employees and talking about vaccinations and whether or not it's okay for employers to mandate vaccinations. And this conversation is going to continue to ramp up in the days to come. And one of the questions I wanted to ask you, Paul, around vaccination, you mentioned you had 5 kids, and with schools, what is different and what is the same with what's happening now? Of course, I'm sure fairly soon, vaccinations, and there's going to be one of them are going to be open to kids under 12 here at some point, I would imagine shortly.
Yeah.
And of course, most schools mandate certain vaccinations, right?
Yeah.
And tell me the difference and what is the same with this situation we're in for why some schools would do it or would not do it, and what should we, as parents, what would you, say to them or caution them in?
Well, I think one of the thoughts I've had as a parent of 5 kids, and if I'm lucky enough, 6 someday, is that the other vaccines that these kids get are for diseases that are really potentially dangerous to them. And then let's look at COVID. Is this a real threat to these children? And statistically, it's not. There really isn't any study that shows that the kids are at great risk, that they're super spreaders of this thing, or whatever. And yet we have teachers' unions, and we have, groups that would like to require vaccination, or I think it was even, I saw today, the president of one of the largest unions saying that, maybe the schools should stay closed. I think it's incredulous. I mean, it's incredible. Why not simply vaccinate the teachers, protect them, and let the kids go to school? That's not based in science. It might be based in political science, but it's not based in science. Does it make sense to vaccinate children against polio? Of course. But when you talk about a disease that targets elderly people, obese people, and people that have other serious underlying health conditions, we're not talking about young people largely. I mean, it's not a scientific study, but watching my children go through it and then reading the science that comes out. I mean, my experience anecdotally was the same as what the studies have shown. It's not a seriously different risk to children than the flu. So should we act as though it is?
Yeah, one of the questions that
seems to go to school.
One of the things that someone would say, well, they may not be in grave danger, but they can still transmit it. What would you say to that argument?
Well, that's true. I mean, that's true. That's true with the flu as well. And yet we don't require it to go to school. So, and the other thing I would say to that is, if you are vaccinated, it kind of goes back to that. Let's focus on the high risk part of our population. I don't mean to be callous and say that it's not important as Americans to band together and protect our whole population. I think we should, and I think people are in favor of that largely. But if you are at high risk and you're vaccinated, is a child who's unvaccinated a high risk to you and your health? There's no science that says that that's true. So if that's not true, then what would we do? Why would we do that? Why would we require that? I mean, I would like someone to come up with some study that says we should do that, with some science that backs it up, and that will not happen. I mean, I do not expect to see that.
Yeah. Paul, what do you, in the last couple of minutes we got with you here, what does all of this, in your thoughts, say about where the healthcare industry is at? And is there any possibility of change or reform?
That is what I spend every day working on. And I don't expect it to come from Washington or even really state governments. We have a fifth of our economy that is so heavily lobbied for that it almost regulates itself. And I could give you so many examples. It's a really incredible that we see the things that we see in our system. And we have one of the most powerful forces in the world, the American consumer. Everybody that creates any product, invents anything good, wants to sell it here in America because the power of this consumer here, this consumer base. And we, by design, in the current way that we handle the way we pay for healthcare, have insulated or hidden the data that's needed for a consumer to effectively consume healthcare. We go out, it's the only thing that we go out and buy, and we have no idea what it costs. We have no idea how the person that's providing it compares to others who provide it. When you buy a TV, you can more easily find information on which one should I choose based on quality and cost data in healthcare. And we have so much work to do. If you just look at the last 11 years, if I gave us a quick report card on how we've done since the ACA kicked in, I would have to say deductibles are up 87%, premiums are up more than that, and insured Americans hold $141 billion in medical debt. That is incredible. We can do so much better. And I don't think it would be that hard if we brought transparency into the system and gave the average American the information they need to consume well and gave them the right incentives.
So, I mean, do you see a way forward, or is it?
Absolutely, I do. I think we see little lights headed in the right direction. And I can tell you, I do. It's an optimistic conversation, although it doesn't sound like it. There are employers all around the country that are creating health plans that get the information in the consumer's hand, where they're able to make good decisions. They drive down costs. Their plans run at half the national average in terms of cost. They get better health outcomes for their people. There is a path forward. I actually am very excited about it. I wake up thinking about it. We can do this, and we are doing it. And so it is a very positive thing. But it's not going to, I don't think it's going to come from Washington, because the lobbying is so heavy and there's so much pressure against it. But we can do it, and we are doing it on a daily basis. When you look at this transparency rule that kicked in January 1st for hospitals, that was one of the few really good parts of the Affordable Care Act. It took 11 years for it finally to get enforced. And what we see is that only 20% of hospitals are complying with the rule to publish their pricing. Is that a lot to ask? We should know what things cost in America? I mean, that's incredible. For 300 common procedures, they're supposed to publish their pricing. 20% are complying, 80% are not. The fine is $300 a day. And when you look at the balance sheet of a typical hospital, unless it's a rural hospital, let's put that in a different category, but the rest of the hospitals out there, that $110,000 a year fine for not complying is a rounding error. And for those who have complied, we're seeing they have, on average, more than 150 prices for every procedure they perform. Let's get that out there. Why shouldn't consumers see that? Why shouldn't they be able to consume healthcare like they consume everything else, by judging cost and quality and saying, I think I'd like to get this procedure done here? And I think we just need to continue on that track, get transparency into the system. We can do it. We definitely can do it. And where we see it happening, when you take the insurance payment model out of it, let's talk about cosmetic procedures, elective procedures, where people pay cash. You have some of the I had an elective procedure done, and for some reason, I feel obligated to say it wasn't cosmetic, but even though no one can see me right now. But I found the best provider in the country. It was a surgeon in LA. I flew there. I paid $10,000. Had it been deemed medically necessary to get this procedure, my plan would have paid north of $50,000 for this procedure with my insurance.
Wow.
And it wasn't. And I go down and I pay cash, and I get the best guy in America to do it for $10,000. You see it with LASIK. You see it with cosmetic surgery. It's working. What we need to do is get the information flowing freely so that it can work across the whole system. And I think we can do it. I'm actually pretty optimistic about it. And that's really what I wake up every day to work on.
Yeah. Paul Seegert, thanks so much for joining the Live from Seattle show today. Really insightful and helpful, and I really appreciate it.
Thanks for having me. I hope we talk again.
Yeah, absolutely. That was Paul Seegert, managing partner of PCS Advisers, working in the healthcare industry, helping folks like you and I to get the best healthcare we can.